Next, we have Staphylococcal infections. This is a bacteria that's most often found in the nares, and it's found in about 30% of the people in our population, but it's not typically an issue. It becomes an issue when an infection develops. And people who are immunocompromised are highly susceptible to staph infections. The problem is that there are many staph infections that are resistant to antibiotics. So, if they're resistant to antibiotics, they're difficult to treat. They're transmitted primarily through hand-to-hand contact or airborne transmission, so it makes them highly contagious. And as healthcare professionals, it's very important that we practice universal precautions, which means that every time we enter a patient's room, we wash our hands, we put on gloves, all of those minor little safety precautions that we are practicing really now with COVID, but it's extremely important that we do that in a healthcare setting. As I just stated, some staph infections are resistant to antibiotics. One in particular that is very common is MRSA, or methicillin-resistant Staphylococcus aureus. You'll hear that term often, and that is a highly contagious staphylococcal infection that can cause lots of issues in the hospital setting. There are two types of MRSA. You have the healthcare associated MRSA and the community associated MRSA. Now, the community associated MRSA typically is seen in the sports community, or where there are lots of crowds and unsanitary living conditions. So it is common in homosexual activity, patients who have HIV, and people who use illicit drugs. So the symptoms of Staphylococcus infections are swollen and painful bumps that may look like pimples or spider bites. They're very warm to the touch. They fill with pus or other drainage, and the person may have fever. If it's caught early enough, the Staphylococcus can be treated by using an incision and drainage technique. It's called an IND, where they go around and incise the tissue and drain out the tissue, and typically that's followed with a series of antibiotics. Again, if it's MRSA, they have to use a series or a different concoction of antibiotics because it is resistant. It's not 100% ineffective, but it is resistant. So they have to use a variety. Another way to help to decrease the occurrence of a Staphylococcus infection is to make sure that the wound or the opening is cleaned and with soap and water, or using a specialized soap such as HippieCleanse, which is a specialized soap to clean injuries. Encephalitis is another infectious disease. This is an inflammation of the brain, and it is generally caused by a viral infection. There are two forms of encephalitis. There's primary and secondary. Primary is caused by the direct viral invasion of the brain and the spinal cord. This is a very serious type of encephalitis, and it can be sporadic or epidemic. And a sporadic encephalitis arises from the herpes simplex or the varicella zoster, remember, which is your chicken pox, and the measles, mumps, and other viruses. So, you've got this chaining effect. So it's very important that you receive these vaccinations, or a child receives these vaccinations, so they're not going to be as susceptible to these more complicated or other complicated infections that can arise. The epidemic type of primary encephalitis is typically caused by mosquitoes. Secondary encephalitis is typically a complication of a viral infection in another part of the body that enters into the brain. This is the most common type of encephalitis that occurs. So the signs and symptoms of encephalitis are secondarily, they generally appear 5 to 15 days after being bitten by an infected mosquito. So our secondary encephalitis, as we know, is from mosquitoes. So it occurs 5 to 15 days following that. They may have sudden fever, headaches, vomiting, photophobia, stiff neck or back, confusion, drowsiness, clumsiness, unsteady gait, and irritability. So treatment. Because encephalitis is a viral infection, it's not responsive to antibiotics. So your treatment is going to be geared more to the symptoms and the side effects and maintaining the rest of the body's systems. Making sure that the patient's getting adequate nutrition, making sure they're staying hydrated, and their ventilation, making sure their breathing is maintained in a proper proportion. Also, if the patient's exhibiting more severe complications such as seizures or edema, swelling, then doing some techniques in order to be able to control or halt those issues. Next, we have the Zika virus. The Zika virus is transmitted by a specific mosquito called an Aedes, A-E-D-E-S mosquito. And what happens is in pregnant women, it results in loss of the pregnancy or birth defects. And the birth defect that is typical of this Zika virus is microcephaly. And microcephaly is a defect in the brain development, and usually it results in the baby having a small head. This is a relatively new a virus that has been talked about in the news recently in the last several years. Once the person's infected, they can spread the virus via the mother to the fetus. And the problem is that the infected person, the infected mother, may not be aware that she's even infected. So it has been found in the blood, in breast milk, and semen. Viral meningitis is our next infectious medical condition, and it's an inflammation of the meninges and the cerebral spinal fluid surrounding the brain and the spinal cord. It's viral, so it's benign, meaning that it's not going to cause any more advanced significant deficits. It's mostly self-limiting illness. It's generally the viral meningitis is less severe than the bacterial meningitis, which we're going to talk about in a minute. It is contagious via direct contact with respiratory secretions. So, if a person's having this viral meningitis, they need to be isolated from others for the period of time when they can be contagious. Signs and symptoms of viral meningitis include that it can be accompanied or preceded by non-specific malaise or an upper respiratory infection. They may have sudden onset of a high fever, headache, and cervical rigidity. They possibly could have nausea, vomiting, and diarrhea. The treatment for viral meningitis is typically supportive, managing those co-issues that occur, the tiredness and so forth. You know, they usually recommend bed rest, increasing fluids, taking over-the-counter drugs for the headache and the nausea, doing medications to prevent the nausea or relieve the nausea and the vomiting so that they don't get dehydrated. Acute bacterial meningitis is potentially life-threatening. And again, it's an infection of the meninges and the cerebral spinal fluid. The difference is this one's bacterial versus viral. Now, if it's not treated, it can be fatal in 50% of the cases. A specific bacterial meningitis is meningococcal meningitis, and it can result in permanent brain damage, hearing loss, learning disabilities, the loss of a limb because of the need for amputation, kidney failure, and death. So it's spread via respiratory and throat secretions. So again, you don't mess around with this. This is something that it can be contagious to others. It strikes suddenly, and it's prevalent in areas where there's close living, such as military barracks and college dorms. So this is one of those diseases that are infections that can be treated with an infection, and most universities require that students get that vaccination. One of the complications with meningococcal meningitis is that it appears like the flu. So the symptoms are often mistaken for the flu. And in reality, it's this bacterial meningitis, which can be deadly. The treatment for acute meningeal bacterial meningitis is IV antibiotics first, and then they also treat the complications such as the hearing loss, convulsions, and so forth. So that finishes chapter 15. Again, that was very brief overview of the different infections. You need to read the book so that you can get more information about those.